Assalamu alaikum. The communication day. First scenario, you are the doctor, the senior house officer on call today. You have been asked to discuss the issue with Mrs. Kate and answered her concern and questions. The scenario, Miss Kate, 26 years old, was originally referred to the epilepsy clinic with a 2-year history of frequent episodes of apparent loss of consciousness. She's taking anti-epileptic medication. These attacks were recently witnessed on the neurology ward while she was undergoing video electroencephalogram (EEG) telemetry. The episode don't have an epileptic basis on either clinical or EEG grounds. Other investigation has also have been also normal. Diagnosis of non-epileptic attack disorder has been made. The neurology team have agreed that no further investigation are required. Ready?
Yes, doctor.
Okay.
Okay, here you go.
Hello, I am Dr. Mansour, one of the doctor in the clinic today.
Hello, doctor.
Are you Miss Kate, 26 years
Yes.
old?
Yes, I am.
Miss Kate, we are here today to discuss about your medical condition. Is it all right with you?
Okay.
Can you tell me more about your medical condition, Miss Kate?
Yes, doctor. Since 2 years, maybe, I am suffering from recurrent shaking of my body. This is recurrent actually, and I went to the doctor, and some medication given to me. They said that it is maybe epilepsy, and I'm taking medication, but without benefit actually. Still, I have this shaking of my body.
Sorry for that, Miss Kate. I am here to talk with the result of your investigation. You have done brain electricity measurement and also video monitoring during this measurement, and the result was revealed and showed what's called non-epileptic attack disorder. Do you hear anything about this?
What you mean by this?
I will explain that for you. But firstly, I want to say to you, this talk between us will be confidential. It will go no outside it. So feel free when you have questions or want to say anything. I will explain for that. The causes of fits, one of them is what's called epilepsy, and it's abnormal chaotic brain stimulus in the brain spread all over the body or special part of the body. And for this, we took medication. But unfortunately, was this not confirmed? And you have taken the medication for that.
What you mean,
Yeah.
doctor? You mean I am putting these attacks, putting in these attacks, or
No,
lying or lies?
no, doctor. No, Miss Cat. Please don't misunderstand what I have said to you. I am not saying you are lying or something like that. I want only to explain the result for you and discuss what is the cause of your fits.
Okay.
So with this measurement and monitoring with video camera, we have excluded this disease. And the team of doctor who has this measurement, seeing it is not probably coming from epilepsy. The cause of this what's called yes, you can see, Miss Cat.
What is the cause? I just I want to ask, what's the cause of this shaking of my body?
We said that functional fits. When someone under stress or conflict, his body will suffer from the same fits. And the treatment, do you follow me?
Yes.
Yes. The treatment of this fits is no medication, but search for the cause. and treat the cause. I am here to talk with you about that. Do you
Okay.
have any
So
stress at home or with while with work?
yes, yes, I have stress in my life. I think all people have stress. But you mean the stress is the cause of this, doctor?
Yes, that's one of the causes. Some bodies react of stress and can cope with it. The other cannot tolerate and may manifest as symptom what as you have with fits. It's different, the response of stress from one body to the other.
Okay.
Can you say to me where is the stress now? Is
Uh,
at home?
yes, yes, I have
Is
some problems with my
at
husband.
home or at work?
Yes, in the home, and also in the work,
I'm
actually.
sorry. I'm sorry for that. Uh, Regarding work, I can refer you to the occupational work. If any conflict with the team or the manager will help you in resolve and found for you a solution for that. And regarding for whom, can you tell me more about that if I can help you in this regard?
Uh, I feel, doctor, that it is not as is a real diagnosis. I feel there's a hidden diagnosis, and I think I want to do further investigation to
You,
clear the
you,
diagnosis.
your concern is valid, Ms. Guess, but we have the team, and the team has controlled the measurement and correlates it with the video monitoring, which has confirmed that you have no epilepsy,
Okay,
and what you
so
have is called non-epileptic attacks. Be
okay,
sure that
so what's the medication you will give to me now to prevent this shaking attacks?
that's a good question. As I said, we try to search for the cause of this shaking attacks. What's on top of that is stress. So I advise to consult mood doctor to help that. And mood doctor doesn't mean you are mad. It's to help you to coping with the stress. What do you see?
Okay,
How do you see that, Miss Cass?
okay, no problem.
Okay. What are you doing for living, Miss Cass?
I am secretary in a company.
In company, and that's contact with clients every day and with the manager and worker.
Yes, yes, more work and more requests from my manager and other employee. Actually, it is stressing me all the day in stress.
Yes, I can call the occupational worker if any possibility to reallocate you inside the company or to management stress or make different working hours. He may have many solutions and many ideas that can help in this regard.
2 minutes left.
Are you
Okay.
smoking, Miss Cass?
Yes,
How much on over how many years?
maybe 10 cigarette per day since 5 years.
In cigarette but I advise you to stop smoking. I know that's when a man is stressed, may smoke and it's difficult, but smoking is very dangerous for your health. And I advise you, if you want any support, to refer you to smoking cessation clinic.
Okay.
Is it okay? Do you drink any alcohol, Miss Katz?
Yes, in the weekends.
Okay, below the limit, no binge drinking.
No. Yes.
Do you have any concern, Ms. Kelsey?
So should I stop this medication of epilepsy?
Yes, that's good question and valid concern. Yes, you should stop this medication. There is no need to take this medication.
Okay.
Do you have any other concern, Ms. Kelsey?
No, thank you.
Okay, thank you, Ms. Kelsey.
You have 30 seconds, Dr. Ahmed. Do you want to give any advice, safety netting, red flag?
Okay, I will give you brochure and contact and internet sites for group of patients with the same condition. You can exchange knowledge and information between us. He may benefit you also.
Okay.
And I advise you to, for the next months, to avoid contact with sharp needles or sharp object to avoid harming yourself if
Okay.
this happens.
Time is up. Thank you,
Thank
Dr. Ahmed. Well done. Dr. Hani, you can comment, then I will comment.
Okay. Well done, Dr. Ahmed. This actually maybe recently appeared like these scenarios. It is a convergence syndrome or functional problem. There is symptoms, but there is no disease. There is a functional or convergence syndrome also. So we can start this? You must assure the patient that it is not acting or not lying. So you can say, I want to start by saying that we absolutely believe your attacks are real. They are not imagined, and you are not making them happen. Okay, this will reduce the defensiveness and reassure her about that. Okay. After that, you can say about, as you said, about the investigations. That is normal, EEG, and also about what they see during the in the ward. It is not epileptic, not an epileptic basis of this shaking of the bodies or this epileptic fit. Okay. So about that, after that, we can explain the problem. Okay. You can say your brain structure is healthy, but sometimes the way it functions gets disturbed. It is a bit like a software problem rather than the hardware problem. Maybe she, as a secretary, can understand software and hardware. You can do like that. There is no structural problem in your brain, but the function of the brain is disturbed. Sometimes the brain reacts to stress or emotional overload by switching off or causing seizure-like episodes without electrical seizure activity. Okay. And you also must confirm that it is not for acting or like that, or these attacks are not deliberate and you are not in control of them. They are automatic response from the nervous system. Okay. After that, you can reassure the patient. Okay, become empathy and show sympathy with his condition. Okay, and discuss the treatment after that, the management plan. Okay. You can say the good news is that there are treatments that can really help, especially talking therapists that focus on how the brain handles stress. And many people improve once they understand what's happening. Okay. And because there are epileptic seizures, and the anti-epileptic medication will not help, so we can review that safely with nerve doctor. Okay. This is my comment about the case. You did well, Dr. Ahmed.
Okay. Yeah, thank you, Dr. Hani. What about the skills? So the clinical communication, what do you think he deserved the satisfactory?
Yes, satisfactory, yes.
Okay. The clinical judgment regarding
Maybe,
stopping the medication is a very important point.
yes, it is an important point. Yes, that's right. He said he no benefit from continuing this medication.
Perfect.
Mm.
So we're gonna stop it.
Yes.
Okay. So regarding clinical judgment, he also deserves satisfactory. What
Yes.
about concerns? Any missed concern?
No, all he answered all the concerns.
Okay. He addressed all concerns, so satisfactory as well. The last one is the welfare. What important point here he should address and he didn't do?
Yes, about the driving.
Driving,
Perfect.
yes.
Yes.
I have skipped because I was not sure of should stop or not.
No,
Even
no.
yeah. Okay.
Even
Yes.
if this is not epileptic fit,
Exactly.
but you must stop driving until.
Perfect. Yes. So it must be stopped, Dr. Ahmed. So you will be minus and the welfare. Okay. You have to ask it. Any shakiness, not only the pathological one, even the physiological one, and the essential tremor, any shakiness, you have to address the driving. You don't know what will happen. Maybe the patient will have the attack while driving, and he might harm himself, or she might harm herself. So it's important to address it with the same three question of do you. And I don't prefer to say, are you smoker? Okay, do you smoke? Do you smoke? Do you drink alcohol? Do you drive? Whenever you have any of them, you have to address it. The alcohol also, you address it perfect regarding the binge drinking and the social limit. So you will be minus only in the welfare. This is my comment. One more also, you have to add to your talk whenever you have functional disorder, relaxing technique or relaxation technique. Okay, I read it in one feedback. It was mentioned by the candidate and they put it as a positive comment. So relaxation technique you can offer to the patient or to the surrogate whenever he has stress in his life. What about the stress in the work? Stress in the work you can reallocate as you did, or vacation. How if you take vacation to relax, to see or to sit with your family, to travel for to calm area. All the things can help. Yoga also, some of the doctors mention it. Yoga, you can go to yoga training, and it's good relaxation technique as well. Swimming, those things can help patient to calm down and to relieve from the stress. Okay, so whenever you have stress, try to find out what the cause of stress. Is it something financial? Is it house or at home, or in the job or the work? Any of them, you have to address it. What about the patient mood? Does he need or does she need to be referred to a mood doctor? What do you think, Dr. Ahmed? Can you say I will refer you to the mood doctor? You can hear me, Dr. Ahmed? Okay, so I will answer this. Yes, I can say we will. We can also send you to the mood doctor.
So
He
sorry,
can.
I was muted. Sorry.
Okay, it's okay. So how about it?
Yes, it is recommended in this
Yes,
conversion hysteria, especially when she has fits and may be dangerous when falling, even if malingering should be psychological support.
perfect. How you can address it? What you can say? If
I
Okay, let me tell it how it will be going. The patient will tell you, Doctor, do you think I am mad? I'm crazy. What do you say if she
No,
said that?
the mood doctor will help you
Yes,
is the expert in uh, to do how to deal with stress and cope with it.
perfect, perfect. And they have their own technique. They can just have a sit with you. They can talk with you. What we call it talking therapy. They can talk with you and relieve you from this all stress in your life. Okay, in this way. Do you smoke? Do you drink alcohol? Very important. And in some functional disorder like irritable bowel syndrome, you can advise regarding the diet itself, the diet regime, and the what type of diet the patient is taking. Avoid spice food, avoid the junk food. Okay, all the things can help, and in particular for irritable bowel syndrome. But for our discussion today, the epilepsy or the functional epilepsy or non-epileptic seizure, now you can address it by stress all over. And I like the word overreacting, Dr. Hani. What we mentioned, software and hardware, it's good example, but maybe the patient will tell you what the meaning of software. I don't understand. The best word I like.
Yes, sometimes maybe the patient can't understand
Yeah.
this
So the
this
best
example,
word, yeah, I
but
know it's
it's a
example.
common example actually. Some monitors say that many
I don't know
times.
in the examiner how they can judge on it, but the best word I like to say, your brain or your body overreacting this to the stress with this abnormal movement or with this abnormal loose motion. Okay, so overreacting to the external trigger or stimulus from outside. This is what I believe the best word. Overreacting to the stimulus or to the stress by this way. Everyone has his approach. He can say whatever he wants, but the best and simplest word, overreacting. Our body usually react to the stress normally, but some people, individuals, they overreact in this way. You are one of them. Okay. Okay. So you will get 14 out of 16. The point will be minus in the welfare skill. Okay, Dr. Ahmed. Any question, Dr. Ahmed or Dr. Hani?
No, thank you.
Thank you, Dr. Tani, for case and the
Okay.
comment from Dr. Bassem.
The last thing I want everyone to do at the end, if you have certain seconds, even 10 seconds, leaflet brochure website for the closure. Or if you have any other different experience, because she knows her seizure, how it goes. What if she has different seizure? You have to give her safety knitting, red flags. Please, if you have different seizure that you are usually have or you usually had, please immediately call us and visit us. Okay, because usually the patient sometimes this conversion disorder might be real one with pathological underlying. What if this patient thought, okay, this is the same, I had it before, I will not go to the doctor, and it will be, for example, after head trauma, and this is or this time is pathological one. Maybe it will have or she will have it again with also loss of consciousness. Maybe it will be dangerous for her life. What I want to say, at the end of any functional disorder, give red flags or safety netting about abnormal pathological one. If you have different presentation of the one you have it commonly, please call us. Okay, and offer the leaflet brochure, social groups as you did exactly. Anyone has comment? Okay, Dr. Tahani commented, need to stop driving. Perfect. Yes. Need to be away from fire and sharp objects. He did so. Need to stop smoking and reduce alcohol. Perfect. All of them should be addressed and advised. The way also to address the sharp objects, good, from Dr. Ahmed. Perfect. Driving, for how long will stop driving? Dr. Ahmed or Dr. Hani? What if she asks you for how long, doctor?
We will do another meeting and reassess you
Yeah,
and
so
inform you.
perfect. This is good answer. So temporary, please stop driving at least 1 month. Then we'll sit with you again if you don't have this seizure again or this abnormal movement. What other option you can tell?
I will inform DEFLA
Perfect.
and do
Yeah,
assess you.
yeah. Contact Divla. By the way, you are not the one informing Divla. The patient will contact Divla by herself.
Okay.
Okay. So she will get the license from Divla itself. DVLA. Don't say Divla. DVLA. Driving Vehicle License Services. Right. You have to mention it in this way. Don't say Divla. So either to tell her we will reassess you again, or you can contact the DVLA or Driving Vehicle License Services. They will give you the approval when you can start or resume your driving. Okay. I have sent the case per WhatsApp. Okay, this is Dr. Ahmed. He sent me the case. I will share it again here.
Thank you, Dr. Basim. Sorry, I have
Awesome.
technical problem. I'm outside.
No worry at all. It's easy. Any comment from other candidate before starting second scenario? Dr. Hani, this is your scenario in the chat box. I will read it quickly. It's lengthy one. But again, whenever you have lengthy scenario, try to make it as a summary at the end in your paper. Okay. Okay. This is your scenario. 69 years old, woman with a background history of diabetes, hyperlipidemia, and renal calculi. Sorry. Was admitted to the acute medical unit last night with a 1 day history of low back pain, urinary retention. She denied fever or constitutional symptoms. Her husband reported that she had been off legs. Her vital signs were satisfactory. She was seen by the junior doctor who recorded renal angle, tenderness, and distended bladder. Her post-void residual urine volume was about 400 ml. Investigation arranged by him showed normal full blood count, liver function test, serum creatinine. There was 64 white blood cells, and 12 red blood cells in her urine. Diagnosed pyelonephritis and commenced her on ceftriaxone and paracetamol. The consultant who examined her this morning noted that the power in both legs was grade 2 out of 5. Sensory perception was diminished throughout both her lower limbs, and parental response was extensor bilaterally. An urgent MRI scan of the spine showed mass at the level of T10, T11, compressing the spinal cord, which was possibly an epidural abscess. The orthopedic surgeon has taken her to the theater for urgent operative decompression and biopsy of the mass. He felt that a prognosis for recovery of leg function was poor because of the delayed referral. Unfortunately, there was no record of the neurological examination of her legs on the previous night. You were the registrar in the acute medical unit last night. Your task is to talk to the distraught junior doctor. He is deeply upset that he missed the spinal cord compression. Really, it's a good scenario. Thank you, Dr. Ahmed. And good luck, Dr. Hani. 2 minutes, and if you're ready, let me know.
So the discussion will be with whom? The discussion was the relative or the patient himself?
It's a discussion between the two doctors. The one was in discharge, it's the junior doctor who missed the diagnosis, and you are the senior doctor.
Oh, okay.
So you will sit with the doctor who missed the diagnosis, right?
Yes, doctor.
Okay.
One more point, and I want to address and to explain. Whenever you have functional disorder, don't break it as bad news. Just tell the patient, I have reassuring news today for you. What do you mean, doctor, by reassuring? So you can tell her or him everything, the results are normal. How? What do you mean, doctor? Then you can explain. I like when Dr. Ahmed said the diagnosis itself. This is what I want from everyone. Say what the patient is having, then explain it. You have a condition called non-epileptic, for example, seizure. Then explain it. What do you mean, doctor, by this? What I mean is something normal, but there is underlying stress condition that the body overreact to it with this seizure in this way. Okay. Okay, ready, Dr. Hani?
Okay.
Okay, here you go. I set the timer. You can start.
Hello there.
Hello, college.
Yes. Uh, my college. Can I confirm the name?
Yes, I am your college. I am Mansoor.
Yes, Dr. Mansour. How are you, Dr. Mansour?
Not good.
I am sorry to hear that. Can you tell me? I see you are upset. Let's sit down and talk. What happened?
Yes, you was with me in the round.
What happened?
She come yesterday with urinary retention and back pain, and I have concentrated on the renal stone. I have said this is bad UTI infection. I am stupid.
I am sorry to hear that. And I think you are a smart doctor, but missing something like this. Yes, it is really distressing, but it is understandable. Uh, uh, and yes, you can feel you are shocked like that. But can you talk me through your assessment last night? How you assessed this patient?
Yes, I have said to you, I have focused in bad UTI.
Yes,
Even I didn't do full neurological examination, and I have missed the diagnosis. The surgeon said she might never walk again because of the delay. It is my fault.
yes, I am
I
sorry to
shouldn't be
hear.
a doctor.
Yes, yes. I am sorry to hear that, Dr. Mansour, uh, and I appreciate your feelings. But I think you are smart, doctor, and all of us we can miss some cases. Uh, and in this case, what I want is that in patient with back pain and urinary retention, we always need to rule out the spinal cord compression. Am I right?
Are you blaming me now?
No, not to blaming you, but just I explain to you what's the usual practice in this, like these cases. So,
Sorry, I am devastated. I'm exhausted. I don't want to speak. Please leave me alone.
okay, it is as you like, but if you want to arrange another meeting, it is no problem.
Why should do meeting with you? I don't understand. You come to me and want to speak with me. I have thought you come to support me and explain what should I do.
Yes. If we found something maybe uh, happening at as not the usual practice, we need to escalate it early. Uh, we need to not miss some serious cases in the future. So just
Thank you, doctor. So, thank you, doctor. I don't. Sorry. Sorry. Thank you for.
okay. I'm sorry if my words hurt you, but it is I don't intend to hurt you or blame you. Just we need to discuss and explain what happened.
Yes,
Uh,
I feel so guilty. I have said to you, I have the mistake. I have done the mistake.
okay,
I
every
didn't sleep
technician.
and I didn't sleep last night.
Yes.
And I have 20 cases, admission of 20 cases, and that's one mistake. I know that was fatal mistake, but no one has thought about the 20 patient what I have admitted at night alone.
Yes, I know. It is a great job actually, Dr. Masoor, to do like these admissions and uh, 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 arrange these cases, all cases. It is a great job. Okay, and I want to say that all of us as a doctors can miss some diagnosis, uh, but it is no need for more blaming of ourselves and doing like that. Are you following me?
Yes, yes,
Okay.
doctor.
So just when we discuss the case, it is not blaming you, not say it is you are a bad doctor or like that. Just clarifying what happened, why this happened, how we can prevent this to happen again, like that.
No, I am concentrated. What is going to happen now? Is the family going to be told it was my fault?
Okay. As you know, our usual practice in like these cases, we already the consultant aware about what happened. Okay. This will likely need an incident report. Okay. It is not to punish you, but so we can learn and improve our system. Okay.
Okay.
And I want to assure you, you are not alone in this. We will support you throughout it, and we all are us working as a team. Okay.
This is going to break my career. I want to apply for specialty training next year. No program director will touch me now.
Uh, I am sorry to hear that, and I appreciate your feeling, Dr. Masoor, and be sure that we will support you. Uh, and just we need to revise our practice, and if it is any misdiagnosis or any delayed diagnosis, we need to improve from ourselves. No need to for more blaming of ourselves, but we are all of us, the junior doctor, the senior doctor, the consultant, all of us are learning from each other and learning from our mistakes. Am I right?
Yes, you are right.
2 minutes
Okay.
left.
Okay. If you say to about what happened after that, we will do discussion about the case and how what is the right steps must we take like these cases. Okay.
Yeah, what about investigation? Did you investigate in this case?
Yes, this investigation done and MRI done for this patient, and there's a suspected epidural abscess suspected, and uh, already operation uh, urgent
No,
operation done for the
me,
patient.
I mean defense. I mean, will you raise this complaint to the director? I'm not talking about the patient. I'm talking from this mistake. Should I
Yes,
call lawyer?
call what? Sorry.
Call defensive medical defense organization?
Yes, we can discuss this with our consultant about the next and further steps for uh, 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 about the legal issues. Okay. We can discuss this with our consultant.
Okay, can I go home?
Okay. Time up.
Okay, time is up. Yeah.
Actually, that is a strange scenario to
Thank you, Dr.
discuss
Hani.
with
Thank you. It's
another
really great. By the way,
patient.
you did it perfect.
Thank you,
We'll try
Dr.
to
Time.
fix. Yeah, we'll try to fix the missed point. It's okay, but all over, you did it perfect. Dr. Ahmed, now you can comment.
Okay, thank you, Dr. Tami. First, it's an unusual case. So when you speak with your college, please you can talk with his name. That's usual.
But it's not mentioned. Not mentioned in the scenario.
Yes, yeah, right. But usually speaking between college without title. Okay, it doesn't relate to respect or something like that when you call someone with his name direct. Second, this meeting was not official. That was collegial meeting. That mean you are should friendly with your college, support him, but to be honest, and also don't forget duty of candor. If he asked, will you tell the relative of this case? Of course, we will tell the relative of this case. Okay.
Okay.
And when we ask him about investigation or so, you can advise him to talk with defensive organization. Okay. So every
What's the meaning of defensive organization?
Lawyer, you have insurance when something problem or mistake, your insurance.
Insurance and malpractice, Dr. Hani.
Yes.
The one you usually do.
Yes, yes.
Okay. You can call, you can say to him, you can contact with him, and will someone come and help you with this official investigation. Okay. The job of doctor are a stressful job. So stress is a risk factor for this job. And we considered when doctor make a mistake should be not alone. He is second victim. He is also victim for system with low number of doctor, feel much work, more stress, different things. That's not our responsibility all the time to stay under stress. If I have stress at the work, stressful work, I know, but with limit. So doctor considered when do mistake as second victim. So in every case when mistake, so you should search for black box from system. Was enough doctors? Was more patients? More stress? More action? That's called the black box. And when you say also we do investigation, it's not to blame you. It's to maintain quality of services. However, if mistake was done, sure, it's not intended. It's your business. May you lose your job. May you don't found training job after that. That's why this malpractice insurance should be involved in this. Okay.
Okay.
So you are second victim. System should be involved and legally defense. But keep duty of candor, should be honest and say for relative what's happened. Of course, they know that was not intentional. It's error, yes, but not intentional. They will not forgive you. But at least when you don't tell the relative or the patient what happened, you have two errors. One, you have lost your job completely and your license. You are not allowed again to practice medicine because you are lying on that not allowed in the medicine. The second will be treated as not good trained and will be punishment double. That's my comment.
Okay, so let's comment based on the skill. The clinical communication, what do you
Uh,
think?
Clinical communication was the start. I understand that was the scenario and
Yeah.
the status quo was not clear.
Mhm.
He tried after that to change the direction, so I give him borderline.
Okay. The clinical judgment.
Clinical judgment is good. It's very good. I found this sentence we all people and
Support.
everyone has mistakes. That's right. I found that good.
Yeah, perfect. And the one who has good react, who learn from the mistakes. So we have done a lot of mistakes, but the
Yes.
good is to learn from these mistakes. Okay, so this is the most important one. The concerns.
The concern here is good. No, borderline because I'm asked him what should tell the relative or what should the relative know about the condition, and he didn't answer this concern. So is borderline also.
Welfare.
Welfare is okay, maintained, satisfactory.
Okay, so it will be 12 out of 16. I agree about this judgment. However, this is not common scenario, Dr. Hani. Don't worry, it's not coming usually to the exam, but at least you did it once in your life. We did like this scenario before. It's about bullying a colleague. The same issue. So two doctors are blaming each other. There is some fight. How to deal with this? But today about a mistake, which is misdiagnosis from the junior. So how you can address it? You did it perfect, Dr. Hani, by the way, as a first communication scenario, and in this way, communication with the doctor or your colleague. So let's start again. How to make the patient, the doctor or your colleague to open up by really telling him, "Don't worry, we are here to support you, but we want to know what exactly happened. How you didn't think about it. Then tell me what happened exactly. Try to explore what happened in the back of the theater, as they say, why he missed the diagnosis, why he didn't pick up or he didn't do the neurological examination. I wrote in the chat box adequate sleep if he is lacking of sleep, so he couldn't focus about it. Or he had a lot of patients. He mentioned already to you that I had a lot of admission, so why you didn't involve your colleague? And the most important, I think Dr. Ahmed also didn't mention involvement of a senior doctor with you. You should involve the senior in every case. This is the most important lesson in any admission. That's why whenever you have this, we will be a team who protect you. Once you have the decision by yourself, it's difficult to protect you. So the insurance will be interfering. But usually we are working as a teamwork. And whenever we had such admission, something you are worried about, involve your senior with you. And this is the real practice, Dr. Hani. I think so, right? We usually do this in our practice. So this is the way how to address and to. Uh, by the way, this is called bereavement, right? Not bereavement, sorry, debriefing. What we call it after doing the work, there is some mistakes. We sit together and we are not blaming. We are just exploring the things, why this happened and what should I do to improve the service next time, the quality of service. By this way, you can just relieve him and tell him whenever the family will complain, the insurance should be valid, and he will do the investigation, yes, and we will see what exactly will happen in the future. What about the training admission or the next training program I apply? Uh, we will try our best to improve your training. Next time you might be able to apply to the training, and they will, of course, they will have exam on you and your performance to see if you are okay to join this program, right? This is the best way to address such scenarios. However, if we do it with a patient, what do you think, Dr. Hani? If this scenario will be with this patient herself, or the family, or the relative, how you can do this scenario? And this is what will be expected in the cases.
Actually, it will be totally different
So
because
yeah,
while
tell
talking
me.
about medical negligence or about
Okay,
medical
negligence mean give it as a term in basis a task. What will be the task?
uh, medical error.
It is exactly it's medical
Yes.
error. You have to admit, you have to acknowledge, you have to apologize. Incident
Mm.
report, the action. I think it will be much easier than our scenario today.
Yes,
So
yes, and
yeah,
it,
you
it, it
expect it so.
the reaction also of of the doctor, it was strange for me. I want to go to home. I not like that.
Yes, yes. I want to tell you advice not
Mm.
only for you and for everyone. Okay, you
Yes,
are expected to have different and difficult with hard-headed surrogate. Okay, he will not be convinced to sit
yes,
with you even. How to address it? Don't tell him we can postpone the meeting. Try to calm him down by any way. I'm so sorry for your feeling, but don't apologize because you didn't do any mistake. So be sorry for him. Try to show some empathy as you did exactly, but don't say to him, "Okay, if you are insisting to go home, okay, we can postpone the meeting." So what if he said yes? Okay, we will go. I will go. I will leave this meeting. Try to calm him down. Sorry. Okay, tell me what exactly now you want to tell. Try to calm him down by any way, but don't let him go. Otherwise, you will lose the scenario. Okay. Other thing, whenever you have scenario which is not understandable, like our scenario today, start to the introduction as every introduction, the patient name, the data. Tell me about what happened exactly with you. What do you think? Then the expectation. Then start to talk with him according to his talk. So let him open up first. Then you can address according to every concern. Even you can do it in pieces. Tell me what's concerning you, doctor. Will I be, for example, in this scenario, will I be in the jail, or will they will complain against me? Then address it as a first complaint. Finish this concern. Go to the next concern. You have any other concern? Yes, doctor. What next? What you will do with me? The hospital. What the hospital will do with me? The hospital will run investigation to know exactly why this happened, and we will improve it. Not only because of you. There is system technique, a system error, as Dr. Ahmed mentioned. It's not only the human mistake. There is system failure. Why this happened? The team is not only the doctor or the junior doctor. There is a nurse, there is an admission office, there is a doctor, there is a senior, there is a consultant, there is a system. Okay, some systems will give you alarm. There is, for example, high blood cells or high blood count. There is something alarming in the result, in the image, the radiology. So it could be as a system failure, not only as a doctor mistake. Okay, exactly as Dr. Ahmed did. Anyway, those scenarios are not expected to have them in the exam. However, as I said, it's better to do it once in your life. you might have it in the exam, and instead of having zero or low mark, at least you know how to do it. You will not forget it again. You'll remember it in one day if you have faced it in the exam, and you will do it in a proper and best way. Okay? You have any question, Dr. Han?
No, thank you.
Okay. Any comments from Dr. Yes, Dr. Omar.
So, Dr. Bassem, just this quick comment for Dr. Hani. I didn't catch up the scenario from the beginning, but Dr. Hani said something when you asked him about when you will talk with the patient, what structure you will follow. It will be a breaking bad news for medical error, not for negligence. Negligence is something completely different, completely different. I don't want you to have miswording in your brain before your exam. Negligence, medical negligence, is a completely different thing. And at the level of the paces, you won't be facing medical negligence scenario because it has different type of talking. Medical negligence will be proven by court. Someone will be found guilty. So you withheld a treatment from a patient. It's not by with good intent. You missed something. This is two completely different terms. Medical error is completely different than medical negligence. The general framework for the scenario today is called the SPICE, SPICE, and the consultant. If this such scenario came in overseas center, it will be examined by a white examiner. Okay. What they are looking to hear, the SPICE, that you are following the SPICE. You are seeking the information. The first S, you are addressing any patient safety concerns and personal safety concern, either yourself or your colleague safety. Taking initiative by finding a replacement for your colleague because he is emotionally stressed, he can't continue the shift for today, and showing support by by answering his concern, solidarity, explaining any misconception about the patient safety or the risk management. They call it the risk management. It's one of the 7 pillars of. Please feel to stop me if I'm saying anything that doesn't make sense to you, to all of you. This is one of the 7 pillars of clinical governance. I will say it in Arabic, الحوكمة الإكلينيكية. What regulates the medical practice in all UK hospitals. Okay. It has 7 pillars. One of them is patient safety, and this is the one that we are tested upon in many communication scenarios. Either you are breaking bad news to a patient, or you do have a junior colleague who did commit a mistake. How you are guiding him to understand the steps of the system and explaining what the risk assessment means, which is when you write an incident form or incident report. This incident report will be assessed if it involves near miss, which means that there was something but no patient harm has happened. As this scenario, the patient didn't have any subsequent neurological damage
No,
from
no,
that.
there is harm in this scenario.
If there is harm, if there's,
Yes.
the scenario was very lengthy, but I feel if there is harm, so there is harm happened, should be dealt with as a never event. So the buzzword is called never event. So has the CT, has the spine imaging been reported and they didn't contain malignant spinal cord compression,
No,
or
no. It wasn't picked up as a
by the
neurological
clinician?
examination.
Yeah,
Yeah. So the junior already mentioned it or diagnosed it as pyelonephritis and start to manage it as the pyelonephritis.
this is, yeah. So this will keep falling as without going deep in the technicality. This will still go through this structure. The last item of the spice is the escalation. The escalation, you already took if you took one escalation in the initiative, taking in the initiative, like you helped your colleague to construct his statement after you thought. This is one of the things that you are doing by taking initiative. Advising your colleague, don't give a statement straight away. Go calm yourself and try to think what happened. Write the statement, revise it with your educational supervisor, and then discuss the case with him. You, from your side, if you are the medical registrar, you have to write your statement in the escalation. This is what they are looking to hear. To tell him that raising this, it doesn't mean that you will be appointed as such. There is so many factors, such as medical staffing. That's not appropriate. So this is will be within the system failure. So how the system will learn? It will learn by reporting, incident reporting, and you have to tell your colleague the buzzword of exceptional reporting. Your junior colleague might be an F1 or just starting to practice medicine after finishing medical school. So he might not be aware of exceptional reporting. Exceptional reporting, if there is any strong deviation from the that it will affect his training. Like you are a doctor and you found that you are the only doctor is attending, everyone called in sick, and your consultant and your registrar doesn't give anything, doesn't give a يعني, is not paying attention, was not helpful. You have to exception report started at the beginning of your shift. I'm alone. This would affect the patient safety. I can't look appropriately after the patient. So this will force the medical staffing to find a replacement to push the ball of ice. Okay. So exceptional reporting is an anticipatory method, which is an advice you give to the colleague in this such scenario. And he should reflect in what happened in his portfolio. So this is the framework that they are looking to hear from you. If this scenario came, less likely that it will come in overseas. But this is for Dr. Ahmed if he faced such scenario in the UK because he's examined UK.
Yeah,
Thank
thank
you.
you, Dr. Amr. Yes, thank you.
Thank you. Dr. Omar will be CEO of hospital, not only medical director, but also CEO.
No, these things are being tested. If you are giving any interview, if you are as you escalate, this framework is being tested every day, on daily basis. So the spice is the steps that you manage difficult colleague, manage colleague who made an error, consultant who made a mistake. You seek info, patient safety and personal safety. Like you will follow the spice technique. They are not inventing the wheel. They are following this structure for more than 100 years. So they are keep doing it on a daily basis. So if anyone wants to ask about the spice, please feel free to ask.
Okay, thank you, Dr. Omar. Again, it's something should be reported whenever and whatever happens, and no to hide, duty of candor. We have to report it, and we inform the colleague that we have reported it as incident report, because there is not near miss. It's already I think it's called incident report, or
Yeah, it will be incident report for all near
yeah,
misses if the patient harm has happened, but this would be full. You will try to phrase the word never event
yeah,
to say it in the station. This is a never event. This
yes.
shouldn't have
So
happened at all.
yeah, the harm already happened, so we have to report it, not to not to hide, and the process of the insurance he should be done by, or it should be done by the physician itself, and our team will do it as a morbidity meeting to improve our service of or quality of service, and to prevent happening it again. I think as I said, it's not common scenario, but just to hear about it, you might face it one day. And the common one
if
will
it's
be
not in the
medical error.
exam, it will
Yeah,
be
yeah, in the
your
real life.
interview. Even though you are doing an interview, this kind of question keeps jumping. Like if
Yeah,
you are doing, if anyone is,
yeah. I think in UK application,
yeah,
right? They are
yeah,
asking such question.
yeah.
Okay. Be ready to have medical error in the exam. So the old scenario will be yes happened, but you will meet the relative or the patient, as Dr. Hani did, or as Dr. Hani said. I will follow the steps of medical error: acknowledge, admit, apologize, and the action. What happened, and what the action we have taken, and of course the result will be updated whenever it's released. This is the way of addressing the medical error in such scenario. Any question from all of you, Dr. Ahmed and Dr. Hani in particular?
Thank you, Dr. Basim.
Thank you, Dr. Bas.
Thank you, Dr. Hani. Jazakumullah khair. You are lucky to have such scenario. I think nowadays, okay, today maybe you are unlucky, but maybe next time you have famous scenario and common scenario. But inshallah, you learn from this scenario how to deal with such scenarios, because you might face it again. However,
Okay.
again, as it's not common. Okay.
Okay.
Thank you, Dr. Ahmed. Thank you, Dr. Ahmed, as well. See you, inshallah. Wish you first the happy weekend. See you, inshallah, in the next week.
Inshallah.
Thank you, Dr. Omar, as well. Thank
Thank
you,
you.
everyone. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.